Hi, I'm Dr. David Dobson. Welcome to Conversations. Today, my guest is Spiros Karkavistas, who is a Marie Skłodowska-Curie Fellow and a PhD candidate in Hyperthermic Oncology at the Ludwig-Maximilians-Universität of Munich. We will be discussing Spiros' PhD research, which focuses on improving the performance of magnetic resonance thermometry in clinical settings. It's a pleasure to have you on my show, Spiros.
Thank you for having me as well. It's also for me a pleasure being here and looking forward for our interesting discussion.
Spiros, please explain to us what is hypothermic oncology and MR thermometry is.
Okay, I will speak simply, not with many scientific terms. So basically, hyperthermic oncology or hyperthermia treatment, to put it more simply, is an anti-cancer treatment, which is combined with other treatment modalities such as radiotherapy or chemotherapy. And when these treatments are combined together, hyperthermia with radiotherapy, for example, it boosts the efficacy of radiotherapy. So the whole goal of hyperthermia is to heat up the tissue, the tumor tissue, for an extended period of time, for example, from 60 to 90 minutes, up to 44 or 43 degrees Celsius. This makes the cancer cells more vulnerable or sensitive to radiotherapy or chemotherapy. And there are many other clinical studies, phase 3 studies that they have demonstrated this improved efficacy when hyperthermia is combined with these modalities. So this is uh, a generic term of definition of hyperthermia treatment. And regarding the second section of your question about MR thermometry, MR thermometry is a method, a non-invasive method to measure the relative temperature change of the heated tumor during hyperthermia using magnetic resonance imaging or MRI in short. So these are the two simple definitions of hyperthermia and MR thermometry.
Uh, Spiros, I'm familiar with this magnetic resonance imaging, which is we normally
Mhm.
call MRI technique.
Mhm.
I have been through an MRI scanner.
Mhm.
So, so I want to ask you, how does MR thermometry fits within MRI?
Okay, so if we can say that the MR thermometry is a specific
Mm,
application of MRI, and MR thermometry basically to apply MR thermometry, you are using a diagnostic the same machine, let's say the same MRI. However, let's say for example, we can use the MRI to quantify or to measure the flow. This is another application of MRI. And
mm,
in order to measure the flow, you are using phase imaging. Okay, phase imaging is used also in MR thermometry. So if I can answer this question, is that we can take advantage the function of MRI in order to measure the temperature in real time during
mm.
hyperthermia. So nothing changes. The same MRI is used in hyperthermia treatment and also in diagnostic imaging. However, with some adjustments of the MRI signal that we acquire, we can measure the temperature as well.
Okay. So I was just wondering why this imaging methods preferred for monitoring the temperature in treatments.
Okay. Yeah, basically MRI, it's the preferred method because you can, as you know, you have been to an MRI scan. They
Mm,
use it's a non-invasive method,
yeah.
and you can acquire anatomical and, information in 3 dimensions. So. if you can acquire diagnostic images in 3D, then you can acquire temperature maps in 3D. And it's the only non-invasive way of measuring the temperature during hyperthermia. However, the standardized or the gold standard of measuring the temperature is using temperature probes, as we call them. And these are usually going into natural cavities of like the bladder, the rectum, or the vagina. And they are placed near the heated tumor in order to have a reference during the treatment. However, using this intraluminal, as we call it, method, we can acquire temperature information only in specific spots. However, with MRI, you can get that information in the whole volume of the patient. So I would say that this is the big advantage of MRI. So it's the method.
I was just wondering what brought you interest to MR thermometry?
Okay, so a long time ago, I did my bachelor's in physics
Mm,
in Greece,
mm,
and through my bachelor thesis, I had that was my first experience with the MRI, and there I learned the theory or the basic principles of MRI, and MRI got my attention because I liked the physics behind it,
okay.
and also my mentor was very passionate, so
Mm,
this is contagious, I think.
mm,
And quite frankly, it was a difficult time for me then, and MRI and standing MRI was a kind of escape for me.
mm,
And yes, through my bachelor thesis, I did mostly quality control of MRI. So nothing special, just to get to know how it works.
mm,
However, during my master thesis,
mm,
I did uh, a preliminary study
mm,
using MRI to measure the temperature in sodium chloride solutions. So this is also simple, but
mm,
during my master thesis, I came in contact with the concept of MR thermometry,
mm, mm,
and I really liked it. And then I learned about the treatment and how it can boost the effectiveness of other treatments
mm,
without having any side effects or
mm,
major side effects as chemotherapy or radiotherapy.
mm,
And then I pursued a PhD
mm.
with a Marie Curie Fellowship in Munich. So, in short, that was my trip until here. Yes,
Interest. Like, so obviously this is continue to evolve and innovate. How old this technology is, like this
it's
therapy?
quite it's quite old. So from
Okay.
about MR thermometers from 1980s, for
Okay.
example,
Okay.
it was first studied. So
Mm,
in clinical practice, I don't recall a specific date, but
mm,
it was first studied. So the first signs of MRI, of using MRI to monitor the temperature, it
mm.
was from that decade.
I want to talk about your PhD. For
Mhm.
your PhD, your research focuses on improving the performance of MR thermometry in
Mhm.
clinical settings using a
Yes.
widely accepted methods of proton renaissance frequency shifts.
Mhm.
Um, can you share why are you interested in this particular topic?
About the proto-resonant frequency shifts, you mean?
Yeah, yeah.
Okay. Because it's according to many studies and
Mm,
according to my small
mm,
experience, this method of MR thermometry
mm,
is the widely accepted method.
mhm,
And it's the widely accepted method, the proton resonant frequency or the PRFS in
mm,
short,
mm,
because it's independent of the tissue that you hit the monitor. So you can use one method for all the tissues of interest during the treatment. In contrast, other methods of MR thermometry, like T2 or T1 as they call them, they depend on the tissue that you hit.
mm,
So um, the major advantage of this method is the tissue independency, and you can use it as one method for all the tissues and during the hyperthermia, and nothing to worry about. However, although it's widely accepted method, it has many challenges. So if I can say it simply, all the challenges that you face during the diagnostic imaging, they are transferred to MR thermometry because MR thermometry is nothing less than MRI. Okay,
Mhm.
and what triggered me is
Mhm.
um, how small adjustments, not big steps, like small steps, can improve the performance, the accuracy of the method, or the repeatability of the method. And I wanted to know the impact of these small adjustments or changes
Mhm.
of the method in clinical practice.
Mhm.
So that's why I used patient data.
Mhm.
I I worked offline, so I knew the workflow of the PRFS methods, and I copied that flow in my laptop through programming and stuff like that. And I wanted uh, to change this workflow with my ideas and see if the performance will be improved at the end. And
Nice.
I specifically say small adjustments because I didn't do rocket science or something like that. Because I really think that I really believe that these small steps are
Mhm.
could be translated into clinical practice. So one day you can apply these changes
Mhm.
and see the effect in real time and not
Yeah.
retrospectively as I have seen it so far.
Yeah. So yeah, I want to get learn more about your research. So can you share how you are conducting your research?
When I was in Munich the last 3 years, I was in contact with the clinical personnel there, so technicians, nurses, and MR physicists. And I watched initially how the workflow of the treatment, and so from treatment planning to the real treatment. And then I I was cooperating with other institutes as well, and I constructed my research questions,
Mm.
and we had a lot of clinical patient data, which was not used for something, so for answering some
Mm.
questions.
Mm.
And I think it's very rare
Mm.
to find this availability in
Mm.
clinical data
Mm.
and without doing anything with them.
Mm.
So I said as a first step, using this data to try to find to answer some basic research questions. And so I would say it's not my way of research was not like from a biologist for a biologist like within
Mm.
lab or
Mm.
wet lab,
Yeah.
mostly computational
Okay.
and reading many papers about
Mm.
MRI and
Mm.
see what we can do. So
Mm.
I would say mostly computational.
Mm. Yeah. You mentioned earlier that you're improving the performance of MR thermometry by doing some adjustment. So I'm assuming that you're making the adjustment on your proton resonance frequency shifts. Uh, so I was wondering, like, when you make those changes, like what type of equipment you use and what those little changes entails.
Okay, so what I use as an example, so for example, during the treatment, during
Mhm.
the standard workflow of the treatment, one major challenge of MR thermometry is
Mhm.
what we call it as magnetic field drift.
Okay.
So this drift is continuous all over the lengthy treatment of 90 minutes,
Mm.
and it introduces an error to the
Mm.
temperature measurement that you acquire with MRI.
Mm.
So in clinical practice, you use image data in order to compensate for this
Mm.
error.
Mm.
However, this is done manually.
Mm.
Um, what I used, which is already known in the literature, I use the body fat of the patient. Okay, so I
Okay.
use the image data of the body fat of the patient in
Mm,
order to correct for this error.
mm,
However, in order to do this in clinical practice, um, you need to use AI to segment the body fat of the patient. You cannot do it manually because it will take forever.
mm,
And I used some deep learning methods, very simplistic, to the data that I had to do it automatically and see the impact of this correction to my data, and significantly improved the accuracy or the precision of the treatment. So I would say introducing AI to the workflow could be a next step,
mm.
although time consuming through the handling of the data,
Mm.
personal data, and stuff like that. But it's a next step forward. This is as an example of how I did one correction.
Can you share what have you learned from your study so far? Some of the interesting findings.
Mm. If we say that the temperature range of the tumor is up to 43 degrees Celsius,
Mm,
so the normal temperature is 37, and you want to go up to 43.
mm,
So in order to have a reliable measurement, you need to have an accuracy of less than 1 degree Celsius.
mm,
So the better accuracy, the better the result.
mm,
And what I could, interesting question. Research finding, I would say from the paper that I already published,
mm,
from that paper, I would say that using some image data within um, during the treatment, you can do much more improvement to the accuracy
mm,
of the MR thermometry. And what I'm researching right now is the impact of gastrointestinal air motion. So what I would say is that there are many techniques out there, but because this field is quite small, there are not so many experts in order to introduce these techniques, these MR techniques to the field and really improve the method. So if you see the clinical workflow right now, it's very old. Okay,
mm,
and getting other people into the field with not not let's say innovative ideas like you invent again the wheel,
mm, mm,
but just researching other
mm,
fields within the MRI. You must think which of these techniques I can get and I can apply into my field in
mm,
order to improve the performance of MR thermometry in clinical practice, because in phantoms it's easy in controlled experimental conditions, but in clinical settings everything can happen.
yeah.
So I would say um, to be open-minded and be patient and connect with other people, see the other perspective, see the perspective of other people, and
Mm,
see what techniques you can employ to your method to improve MR thermometry.
okay. Spiros, I know your research focus on improving the performance of magnetic resonance thermometry. So when you delve into this project topic, so how do you know that or the gap you identify like that this required some improvement?
Um, I through my experience
Okay.
at the university,
Mm,
because I watched how the treatment is done. So I watched the final output of the
mm,
current technique,
okay.
and I mean the errors were quite obvious. It was not um, it was it was not difficult to identify the major errors of the method.
Okay.
And because I was not so experienced when I started
Mm,
about how to process the MR
mm,
data,
mm,
the first challenge that I found I focused on that, and with work, I delivered something I think simple but quite effective.
Nice.
Yes.
Yeah. I was just wondering regarding the work you do. It's very important work and very important research. Typically, when you're doing this clinical trial or in your research in clinical settings, what type of teams are involved in? Like, who are the team members when you're
Hmm.
treating patients?
Hmm. My at at LMU in Munich, the university hospital, the team members in general, or the team members that I cooperated the most.
Maybe kind of in ideal scenario, what would be that team member look like?
The team member is an oncologist,
Okay.
an MR physicist,
Mm,
nurses,
mm,
and a technician
okay.
um, for the treatment planning. So quite many specializations
Mm,
for this treatment, but
mm,
each one of them is important
mm,
due to his or her knowledge.
mm,
And the people that I cooperated the most was an MR physicist
mm.
and other PhD students from external institutes, mechanical engineers, and yeah,
So it's a large team. It's a
it's a large, yes.
collaborative work involve lots of people. I was wondering where does the patients fits in? Like, how do you consult and update? Because for patients, obviously, when they're going through this treatment, they are already kind of stressed about it, and they really
Mhm.
want to get well. And then how do you really involve patient in that steps in the process while they're going through this treatment?
Although I'm not the expert to answer for that,
Great.
my answer will be based on my experience, on what I have seen
Yeah.
from other team members.
Yeah.
Mm, yeah, you're right, because the patient has, let's say, a large tumor in the
Yeah.
lower extremities or in the pelvic. So already it's quite painful. Imagine that the patient already goes through radiotherapy or chemotherapy, so that has additional side effects.
Mm,
The treatment is quite lengthy, so it's like 1.5 hours, and
mm,
so you need to remain still
mm.
in order not to get a good treatment.
Yeah.
So you ask the patient if he or she has any metal components like pacemakers,
Mm,
and
mm,
so these contradictory signs that if you have them, then you cannot go through the treatment.
yeah.
And usually there is throughout the treatment, there are nurses, there are all of the team members are there. There is a constant communication within the patient um, because the patient, if for example, feels in a specific regions of the body the temperature to be quite high, so uh, we call them hotspots. Um, the patient can inform you about that, and you can adjust the treatment in order to uh, quite lower the temperature in that region, but simultaneously maximize the temperature within the tumor.
Mm,
So the patient feedback is also an important aspect of the treatment. Um, yeah, so I would say there are many people involved during the treatment, so the patient is not alone. And the heating device that we are using in order to heat the tumor, um, it's designed for so that the patient can be comfortable
mm,
during this lengthy procedure.
mm.
Um, to be honest, I was not. I only tried the applicator once, so I don't know the perspective of the patient.
Okay.
So yes,
So I was wondering, like, when patient go through this treatment we're talking about, how many treatment normally they require? Do you think that one treatment is good, or they go through like this treatment every
they are going
couple?
through depends on the doctor's advice,
Okay.
but as I have seen, they can go up to 4 to 5, so multiple treatments, hyperthermia treatments.
Mm,
And however, the time interval between the hyperthermia treatments does play a role. So the timing of the treatment uh, or the order of the treatment of the hyperthermia treatment with radiotherapy or chemotherapy does also play a role.
mm,
And this suggested by the doctor how the treatment will go. But to answer your question, multiple treatments, hyperthermia
mm.
treatments.
Are there any side effect of these treatments?
Major side effects, no, there are not. Compared to chemotherapy, for example. So I would say no. For example, if they feel any hotspots during the
Mm,
treatment.
mm,
So no, they're not.
mm,
Of course, there are studies that they claim that they found um, side effects, but compared to the other modalities, I think they're not so important.
mm. So, Spiros, what do
Mm.
you hope to contribute through your research?
Let's say to make some adjustments, to make some small changes uh, directly related to the clinics, which can establish the next stage, so to speak. And uh, now my research was focused mostly in the pelvic region or in the lower extremities, but now I want to really focus on the pelvic region where you have air, and air is a major challenge for MRI and also for MR thermometry. And I want to find a solution, and this is what I'm doing right now. I'm evaluating a method for resolving the problem that air introduces, and I want to combine this correction with techniques like deep learning methods and see the impact on the performance of MR thermometry. And if the performance is better, take the next step and see how we can apply it in real time, I would say. So real time does matter. So we need to find solutions, immediate solutions. There are other ways of doing that, like using faster sequences uh, of MR sequences to do that. However, because I'm mostly focused on that aspect of error correction, this is why my answer is like that. But if you
Mm,
think about it, there are other ways of doing that as well.
mm. Wonderful. What is your advice to future researchers who wish to study this topic further? Because
Hmm.
I'm sure there's more to be done in this field.
Yeah, for sure. Yes. My advice, hmm, do not be disappointed from the start because I will speak with technical terms here, but whoever is in the field will understand. Phase imaging is quite more difficult than diagnostic imaging. Uh, so I would say when I started, it was quite overwhelming because it was too much information for me to process. But I would say at the end of the day, if you see the impact of your work, um, it will give you courage to continue on. So yeah, this kind of a generic advice who I would give to any PhD student. Um, so I think I will keep it like that. To we can end to a high note and close this episode.
Right. Yeah. You mentioned artificial intelligence can be used or is being used to improve the performance. And artificial intelligence or AI is used in healthcare more
Yes.
often as it's continued to evolve. What are your thoughts of integration of AI with magnetic resonance thermometry treatments?
There are many interesting applications of
Mhm,
AI. So far in clinical practice, there is no use of AI. However, um, if you if you avoid any other personal related to the patient issues, confidentiality issues, the impact of these methods is quite big. So, for example, you can use AI, and one colleague of mine who was doing that work, which I found quite interesting, uh, to to speed up the MRI acquisition, so to to shorten the length of the treatment, so to say. So you can use AI in order to um, increase the temporal resolutions of MRI acquisition and avoid the so-called artifacts, MR artifacts. And if you avoid these artifacts, then you get a better a higher quality MR thermometry. Um, so another example is to for automatic delineation through with treatment planning or for field drift correction as I did during treatment. So to avoid the repetitive work of a technician. So you make the life of these people easier, and in this way can be focused into other more important aspects of the treatment.
mm,
So I'm I'm in favor of integrating this technology with MRI and MR thermometry.
mm,
Um, I'm not afraid, I would say, that it will replace the jobs of many people. I
mm,
would say no,
mm,
yes. And it's a matter of time at the end of the day. You cannot avoid it. You must learn how to cooperate with it, how to use it.
mm.
That's my
Yeah,
opinion.
yeah, for sure. Um, what's next for you, Spiros?
Next for me, now I'm in quite difficult situation because I'm completing my thesis and simultaneously applying for other jobs. And I would say if I would go for a postdoc, it would be more MRI related, not so much MR thermometry, because I want to obtain more practical skills in functioning the MRI, not so much computational.
Mm,
Um, However, I want to stay within the MRI field, either within the company or within the university. Um, so yes, I would say this could be a next step. However, it's a problem that I need to resolve quite soon.
yeah, yeah. Thank you for joining me today to share your work, Spiros. I wish you
Thank you.
all the best completing your PhD.
Thank you very much for the invitation. It was a pleasure for me as well, and keep up the good work.